Do you wake up to pee at night? Is it usually around 3 a.m. plus or minus 30 minutes? And if you wake up many times to pee, why is it at regular 90-minute intervals? In this short video, I'll reveal what most doctors and online experts don't usually talk about. Hi, I'm Dr. Stephen Park, ENT surgeon and sleep medicine doctor, and author of the Amazon bestseller Sleep Interrupted. My mission is to help you get the sleep you need for the life you want. If you've been searching the internet or YouTube for why you keep waking up around 3 a.m. to urinate, you'll probably see the same dozen or so reasons, such as drinking too much water before bedtime, prediabetes or diabetes, congestive heart failure, liver problems, circadian rhythm problems, an enlarged prostate for men, an overactive bladder for women, kidney stones, and rarely sleep apnea. Oftentimes, people are given prescription medications with limited results, and they all have side effects. Although all the items on the list just mentioned can cause you to wake up to pee at night, I'm going to argue that a sleep breathing problem is overwhelmingly the most common reason for this condition. And even if you don't have sleep apnea, you can still make more urine at night for the reasons I'll describe later. Let me explain. Obstructive sleep apnea is one of the most undiagnosed conditions where you stop breathing many times every night because your throat closes off when you breathe in. You have to have a certain number of these events every hour, lasting more than 10 seconds for each episode to say that you have sleep apnea. Every time you stop breathing at night during sleep, you try to breathe in against a closed throat. This causes negative or vacuum forces in your chest cavity. This stretches your heart's atrial chambers, making your heart think that there's too much blood coming in. So your heart makes a hormone called atrial natriuretic peptide, or ANP, which goes to your kidneys to squeeze out more urine, and this ends up lowering your blood volume. Typically, apneas happen more often during periods of REM sleep, when you're dreaming and also when your muscles are completely relaxed, except for your eye muscles and diaphragm, so you can keep breathing. Normally, the first REM period starts around 90 to 120 minutes after you fall asleep, and the cycle repeats about every 90 to 120 minutes. As the night progresses, the REM periods get longer and longer, and the deep sleep periods get shorter and shorter. And typically, the longest period of REM sleep happens around 3 a.m. in the morning. So if you've been having apneas throughout the night, you've been making small amounts of urine, and then later in the night, your bladder starts to get distended. But there's one more piece to the puzzle. During the day, your sleep drive goes up, and one measure of this is a rise in adenosine. We know that coffee blocks adenosine, making you perk up, and sleep naturally clears adenosine, so your sleep drive goes down throughout the night as you sleep. So 3 a.m. is the intersection of a bit more urine in the bladder, a long period of REM sleep, and much lower sleep drive. This is why for most people with this condition, you're more likely to wake up around 3 a.m. plus or minus 20 to 30 minutes. Every night, you wake up at the same time like clockwork. If you wake up more than once per night, it'll usually be about 90 minutes apart, which is one sleep cycle. One thing I've noticed is that many of my friends have this, and they mention it casually, and oftentimes joke about it as something that happens with age. This can't be further from the truth. It's been shown that the more times you wake up to pee at night, the higher your rate of dying from any reason. A study published in the Journal of Urology in 2011 found that if you wake up 2 or more times to urinate at night, younger men in their 20s to 40s have a 2.5 times increased risk in overall death rate and about 2 times higher death rate in postmenopausal women ages 50 to 64. I see this all the time. After treating for sleep apnea, the nighttime urination goes away completely or is not as severe. These studies don't conclude what causes the deaths, but I can make a strong argument that the majority had untreated obstructive sleep apnea, since we know that this can lead to heart attack, stroke, cancer, or car accidents. One last comment about nighttime urination. Even if you don't snore, or if you're a thin woman, you can still stop breathing a lot at night. This is called upper airway resistance syndrome, or URS, which I'll link to below. You can still stop breathing, but the episodes don't last more than 10 seconds, so sleep tests won't score it as a formal apnea. You're told that you don't have sleep apnea and that your nighttime urination is due to something else. Making lots of atrial natriuretic peptide and its consequences is the hallmark of UIRS. For example, why you get dizzy when you get up, have low blood pressure, or anxious, or have cold hands. I'll go into much more detail about this in my coming updated video on UIRS. Let me finish with a memorable story about a 6-year-old boy who came to see me for snoring in bedwetting. He had moderate-sized tonsils and adenoids. He also had problems paying attention in school and was also very fidgety. The parents expected that I would offer adenotonsillectomy just like any other ENT surgeon. What we discovered was that he ate ice cream just before bedtime. I told him to cut out the ice cream and have an early dinner with no snacking afterwards. He came back in 2 months a new child. He stopped bedwetting almost immediately, and his teachers were commenting on his much better behavior and ability to focus. And not too surprisingly, his tonsils were much smaller and he wasn't snoring anymore. If you're still struggling with having to get up and pee every night, start with not eating anything within 3 to 4 hours of bedtime. Make sure you're breathing well through your nose so that your mouth stays closed at night. Take a look at my other videos about optimal nasal breathing and mouth taping, which I'll link to below. If you're still not making any progress, see a sleep doctor to formally treat for sleep apnea if you have it. I'm not discounting all the other recommendations by the other experts. My only suggestion is to place a sleep breathing problem as a cause of your nighttime urination much higher on your list to consider. Again, check out these videos on how you can finally breathe better through your nose and why you should consider taping your mouth at night.